Okay, this is the second time I'm trying to record this morning, so fingers crossed it works this time. If you're watching this, it has worked. So obviously, yesterday we looked at the respiratory system and how the lungs act to exchange oxygen and carbon dioxide. Today we're going to have a look at the how some diseases affect the respiratory system and how the heart works to pump blood around the body as part of the circulatory system. So, just some information about the malfunctions of the respiratory system. So, emphysema is the first disease you want to look at. So, in emphysema, the alveoli get damaged. Alveoli are what we were looking at yesterday, which were the little air sacs as the lungs branch out from the bronchus into the bronchioles, finally into the alveoli. They're where the oxygen and carbon dioxide is exchanged, and they're what gives lungs their huge surface area to allow rapid gas exchange. So basically, they get damaged, and the main symptoms of that are reduced breathing capacity, so shortness of breath, and then coughing. And both of those can become progressively worse over time. And emphysema is mostly caused by smoking. So other pollutants can also cause emphysema to happen. So other things that irritate the lungs, certain chemicals, industrial dust and things like that. But smoking is the major cause of emphysema, the most common cause. Lung cancer is obviously another major lung disease. So all cancers are formed by tumours, which are rapidly dividing cells growing in the wrong place. So lung cancer obviously grows on the lungs or spreads to the lungs. And as they grow, they obviously reduce the lung capacity and they stop them from working over time. And again, for lung cancer, the major risk factor is smoking. But sometimes other pollutants can cause it as well. A bit like emphysema, smoking is the main cause, but other things can cause it as well. Tuberculosis is a lung disease caused by a bacterial infection. It can actually affect the body in other places than the lungs, but the lungs is the most common place where it affects. So the main symptoms of tuberculosis are having a persistent cough, a high temperature, and neck swellings. And that happens as the bacteria damage lung tissue as they go, and over time that damage can lead to the lungs failing and death in severe cases. Tuberculosis can be treated by vaccination, prevented by vaccination, and it can be treated with antibiotics. It's now quite a rare disease in developed countries, but in developing countries it is still quite common and kills a lot of people. And used to kill a lot of people in developed countries, a couple of 100 years ago or so. It was very common. And finally, very relevant to what the times that we're living through at the moment, COVID-19 is a respiratory virus. I could give you an explanation of it, but Kurzgesagt, which are a really good channel, have made a very detailed video about COVID-19. So I'll just link to that because they have a lot of detail in it and it's very well animated. So I will link that to you. So looking at that as well as what we've already looked at in relation to how the lungs and alveoli work, that's really the end of the human respiratory system. So we're going to just have a quick overview of the circulatory system as well, and then go into looking at how the heart works. So when we talk about the circulatory system, the major things that includes are, first of all, includes the heart, which we're going to focus on today. We're going to look at it includes the blood vessels, the major blood vessels being arteries that move away from the heart, veins that move towards the heart, and capillaries that branch out from both of those to reach everywhere the blood needs to reach. And then it also includes the blood itself. The blood includes red blood cells, which carries the oxygen around the body, and it includes plasma, which is what gives it the liquid quality, and it does have a bit of white blood cells in there as well, although they're more part of the immune system than the circulatory system. So As I said today, we're going to mostly focus on the heart. And I've done this diagram of the heart and I'm pretty happy with it. You've seen my drawing before and it's not very good, but I figure that's not bad actually as far as my qualities go. So you can see there are labels on here. I'm going to put an image of this onto Google Classroom so you can access it and have a look at it and put it into your notes. And basically, the blue arrows are representing the passage of deoxygenated blood through the heart, and the red ones are indicating oxygenated blood. Now, unfortunately, it's quite a common misconception that when blood is deoxygenated, so without oxygen, that it is blue. That's not actually true. It's a common misconception, but it's not the case. But it's still useful to just use it for the sake of this diagram. So blood is always red, but just for the sake of this diagram, where you see the blue arrows, that's deoxygenated. We see the red arrows, it's oxygenated. So first of all, we get blood moving in through the superior vena cava. So that's the main vein that supplies blood back to the heart. There is also the inferior vena cava down here, which also lets blood in, but most of it's coming in through the superior. So from there, it passes into the right atrium. So from the right atrium, which is the top chamber of the heart, it passes into the right ventricle down here. You'll notice that that's not actually on the right-hand side of the sheet, but it's due to what side of the heart it is in relation to the front of the body. So from there, it moves up the pulmonary artery. Okay. And the pulmonary artery is moving towards the lungs, okay? Now, at the lungs, they pick up oxygen, they get rid of carbon dioxide, they pick up oxygen like we looked at in the respiratory system. And then through the pulmonary vein, they move back towards the heart. They move into the left atrium and down into the left ventricle. And then from the left ventricle, they move up into the aorta, and the aorta is the major artery that supplies the rest of the body with oxygenated blood. So it's a critically important blood artery. All of the veins and arteries on here are critically important, but the aorta is probably the most important. And yeah, just a few things to point out as well. Typically speaking, the rule is that arteries carry oxygenated blood and veins carry deoxygenated blood, but you'll notice that the pulmonary artery and pulmonary vein do the opposite. That's because the pulmonary artery is moving away from the heart, which is what arteries do, but it's still carrying deoxygenated blood as it's moving to the lungs to pick up oxygenated blood. The pulmonary vein is moving back towards the heart, and because it's just picked up the oxygenated blood, it's therefore carrying oxygenated blood, which is why it's doing what other veins don't do. Just a few more things to point out. There are some valves that I've pointed out, like here and here. And here. So the valves, what they do is as blood pushes through them, the shape of them means that the blood can't push back the other way. So if you see there, they can push through that sort of shape, then they can't push back the other way. And that ensures that blood only travels around the heart the way that it's supposed to. Okay? So, like I said, I'll put that onto Google Classroom. And yeah, that is everything about the heart and how blood travels through it.